so I'm going to do it this way so you guys can see both ways. Okay, so what I'm going to do is I'm going to have my quadricep on top. If I come up to my hip, my AIIS, okay, I'm going to have my rectus femoris. I'm going to have my vastus medialis, my intermedialis, and my lateralis, all making my quadriceps. They come down past the patella. Okay, this is my quadricep tendon. My patellar tendon is right here and attaches down to my tibial tuberosity. When I get here on my medial side, I'm going to have my pesian serine. Okay, also I have pesian serine bursitis. Here, I'm going to have my Gerdy's tubercle. Okay, this is where my IT band attaches. For my pesian serine, I'm going to have 3 attachment sites in there. I'm going to have my sartorius, I'm going to have my gracilis, and my semitendinosus, which is a hamstring. Okay. If I want to look at my my tibial heads, okay, I'm going to have him take his foot and bring it inward. Good. And his lateral aspect of his tibia comes out. It's right here. Okay. If I want him to do the other way, I'm going to have him go. Knee stay straight. Knee stay straight. It goes this way. Okay. So you can kind of see when I do that how the 2 sides pop out. Okay. There's my lateral. Here's my medial. Okay. So if I want to find my joint line, it's right above that. Okay, here we're going to have our medial meniscus. Here we're going to have our lateral meniscus right above that joint line. Okay, if I'm looking at my condyles, okay, my condyles are here, my epicondyles are here. Here is my adductor tubercle. When I want to look at some of my ligaments, I can come this way. Okay, I'm going to have my medial collateral ligament coming here. On this side, I'm going to have my lateral collateral ligament. On the inside, I'm going to have my anterior cruciate ligament, which prevents my tibia from coming forward. On the other side, I'm going to have my PCL, which prevents my tibia from going backwards. What else did I not do? Gracilis, straight line, meniscus, fibular head. Okay, bend your knee one more time. Again, when I bring his leg out, okay, one more time here. This area right here, this is his actual fibular head. Right there. Can you turn over for me? Okay, I'm actually going to come to this side. So what I'm going to have, I'm going to go ahead and have my popliteus ligament. My popliteus ligament goes here to here. It assists me with my lock home mechanism. So if you don't know what that is, it's actually up on the board. It was a new slide that I'm going to actually post for you guys. So what's right here, and what it does is when you're in lock home mechanism, your leg is completely extended. And what happens is the actual, in an open chain, the tibia moves. In a closed chain, the fibula moves. The femur moves. So what happens with this is when this contracts, okay, the knee bends, and it gets us out of that lock home mechanism. So we're going to have that right there. Other things that we'll have right here is my popliteal fossa. Remember, we can have cysts in this area. Coming up here, okay, I'm going to have my gastroc, okay, and I'm going to have my soleus. Okay, so my soleus comes here. I'm going to have my hamstrings come down. Okay, my biceps femoris is going to come down this way. On this way, I'm going to have my semimembranosus, and I'm going to have my semitendinosus, which comes around to my pesian serine. On his side, can you lay on your left side? Left side? Okay, I'm going to have my IT band. Keep this leg straight for me. Okay, my IT band starts up here and comes all the way down to my Gerdy's tubercle. Remember, it attaches to my tensor fasciae latae and my glute max. So it's got 2 origins, so to speak. Comes down, it's on this outside. So I'm going to lift up his pants so you get a little bit of an idea. Hold right there, don't let me move you, and it's going to pop out right here for me. Okay? Relaxed. And I'm pretty sure that's it. Oh, one more. My apologies. Sit up one more time. There is a small portion of my vastus medialis, okay? And it's this tiny little area that's oblique. So it's my VMO, my vastus medialis oblique. All part of my vastus medialis, but it turns to 50 to 55%. It's the area that's right here. So if you need to find it on your patient, I normally hold and I say, do me a favor, squeeze your quads. Good, and it pops right out here, okay? Relax. Do it again. Okay, and it pops out right here. It's the first thing that when you have any injury will become atrophied.